you have time to spend about more yourself, enjoy with your friends, going to travel and have fun. You have time now, and this is time all for yours. And it is very important that you keep yourself healthy. I know it is sometimes hard because when you were young, always you can do anything that you want. But now, when you want to go out and have fun with your friends, sometimes you have pain, your mood is low, you don't want to go out. It's all talking today, it's about that. What we can do to stay healthy, be active, have fun, and be healthy. So, I'm sure all of you have your GP and they know everything. They do all the things that is important for you to keep you active. But I just, as a reminder for you, when you are talking about human being, when you are talking about health, you are talking about mind and you are talking about body. Okay, mind is important. Sometimes we get depressed. Sometimes our mood gets really low. We get anxious. We don't want to spend time with others. But sometimes mood is good, everything is fine, but we have joint pain, we have hip pain, we have knee pain. We want to go out with our friends, we want to spend time with them, but we cannot. We say, oh, it's hard for me to walk this distance, or it's hard for me to just carry this stuff, I prefer to stay home. You know, sometimes we don't have any other option. We have to go for surgery, for hip, or knee, or shoulder, but surgery is not something easy. At least I'm not a fan of the surgery, to be honest. As I said, sometimes we don't have any choice. We have to go for it. But my job, as much as I can, I prefer to postpone this surgery for the other stuff, not just with the medicine, not just with the medication. I do some injection. Before that, a couple of years ago, when people thinking about pain in the muscle and the joint, doctors sent person for a steroid injection. It was the first choice. So you have elbow pain, you have knee pain, you have shoulder pain, go and do a steroid injection, you will be fine. Yes, you will be fine, but for how long? And what is the side effect of that? A steroid injection would increase the chance of osteoporosis, and your bone would get weak after that. Some of us has diabetes and blood pressure. The steroid injection can affect on this. So what we want to do, we want to introduce something else. What I'm doing, I prefer to do PRP for my patient. Is there anyone have any experience about PRP? No one? Okay. What is PRP? For the PRP, our body, when we have pain in our joint or inflammation, some of the muscle or cartilage or something in our joint gets inflamed and micro rupture there. A small amount of rupture. And that one would make pain. When they do a steroid injection, they would reduce the inflammation and you would be fine for a couple of months, couple of weeks, depend, who knows. But with the PRP, we would take your blood from you, okay, and separate the healing profile, the rich plasma part. Rich plasma part, it is some part that our body needs for repairing stuff, okay? Under guide of ultrasonography, we will inject to the area and it would push the tissue to reduce the inflammation, get better, get fine. Like you can imagine, you have wheel and the wheel doesn't work well. Sometimes we would put oil around the wheel, that wheel can turn, okay? PRP would be something like that. Less side effect, it is completely natural, and it is your body. Very good, I really recommend this. First, the other things that I'm doing, I'm doing nerve block. What is nerve block? Sometimes you have shoulder pain or you have knee pain because of osteoarthritis. You don't want to do surgery. What we can do, okay? We can do PRP and we can do nerve block. What is the nerve block? We have 3-4 nerve that would cover the area on the muscle and the joint, okay? We can block them and it would subside the pain. Some of you, for control the pain, just always take Panadol Osteo or anti-inflammatory. Sometimes works, sometimes it's not working. But it's for nerve block, for 2-3 months, you would not have pain. And in the meantime, you can go for physio, you can go for swimming to make the muscle stronger. When the muscle gets stronger, the pressure on the joint would reduce and you can be active, okay? All the things that I want to talk about this today to keep you active, it is very important for your mind and for your body. You have all your son, your grandkids, and your daughter, you want to spend time with them. You have your friend, okay? All my goal is keep you active, that you can do all this stuff. Not just with the medication, not just with taking tablet. So, Surena, I have pain, okay, take painkiller, go home. Go physio, go do physio, go home. I still recommend physio. I don't say don't take your tablet or always you have to take your tablet. But you can do some stuff a little bit more advanced. This stuff is new and I think it would help. We have the other stuff like perineural therapy or orthotherapy or acute pain when you have back pain very severely because of lifting and stuff. We can help you. All the things that I want to talk about today, it's about that, about keep you active, okay? So, has anyone any question about that? About the PRP or the muscle pain and so, yes?
With the chronic condition, does the PRP still work?
Yeah. PRP is for chronic condition. All of the things that I'm talking about, the nerve block and the PRP, it is just for chronic condition. For acute condition, we can still do a lot of things, but not PRP. PRP for long term. You know, for example, each 6 months you would send your car for service, okay? For changing the oil, for changing the tires, everything, okay? The PRP is like that. It just maintain your knee, your hip, your shoulder, your neck, okay? It would help. I did for my parents. They are so happy with that. Okay, I'm not here just talk like a doctor with you, like your son, like one of your family members, okay? I'm not here, to be honest, I'm not here to selling something with you. I just say, for example, come here, I have this is fantastic. No. Sometimes it's not working. It is like all the medicine that they have. Yes?
Is there a link where we can go in and learn more about PRP?
Yes. I'm supposed to bring my brochure and stuff and reading material about the PRP. To be honest, we finished them because I have it in my clinic and it's finished. In the next couple of days, I would leave some brochure in here. I would give Joe to bring it here. And you can. And also you can go and you can search about the PRP. Okay. Our website would blow up in the next couple of days, but you can search still. I will write a link for you and I will leave it here. You can go and read about that. I think it would give you some idea about what I'm talking about. Yes?
Botox, what category does that fall under? Is it a PRP?
No, Botox is completely different. Botox would make the muscle relax. It is completely different stuff. So,
My husband has chronic headaches daily, together with dizziness, and he tried Botox a few times, which worked briefly, but then it didn't. And I wondered what category would platelets fall under.
Rose, for this kind of headache, we need to do a lot of things. Sometimes these headaches is come from the neck, sometimes this headache because of the brain, sometimes because of the muscle. Okay, it is not something that I say I have a key and say this key would open all the doors. Okay, I'm glad if I can see your husband and he bring all his medical history and we can see what we can do. But Botox is a completely different stuff. Botox is not for repairing. Botox just make the muscle relax and make them soft. Because of that, most of the time it will help for some kind of headache, not all of the headache. Okay. But what I can do, I do something for the nerve block or the headache for patient with chronic headache. We do nerve block and it would help for 3 months, 6 months. Headache, this kind of headache, they don't have any special treatment. We just try to control the symptoms, okay? And with this injection, we can do that.
Thank you.
Yes,
The PRP,
Rich plasma.
plasma, the injection, I think I'm not, the injection, who is entitled to give the injection? Any GP can do that?
No, it needs some special training because some of the GP do without training. I don't do that. I spent around 3 years for doing this stuff under kind of ultrasonography. I don't like to do blindly and go, for example, oh, this is your hip, go for injection there. No, I do under kind of ultrasound. But still some of the GP can do that.
Is it true that you need to do an ultrasound, then only you do the injection?
Yes or not, some of the GPs can do that. Yeah, but yeah, I recommend always my patient to do ultrasonography first to find out what is the exact problem. And we discuss with the patient. We make a plan with each other. It is not just do the PRP, you will be fine. No, it's a plan. We need to go for PRP, physio, some herbal medication or some medication, review to see how is the progress, what we can do after that.
So can we, when we meet with our family GP, can we say that instead of a steroid jab or whatever injection, recommend a PRP? Would the physician do that?
Unfortunately, PRP is very new, especially in Melbourne. In the Sydney and Gold Coast is more common. But in the Melbourne, it is not something that all GP recommend. A lot of GP recommend now, recently, but some of them still leave a steroid injection. I don't recommend a steroid injection for any of my patients. I work as a GP for 6-7 years in Australia, and I think I have a lot of patients. And maybe in the last 6 years, I just sent 1 or 2 times patient for a steroid injection. I'm not a fan of the steroid injection.
How long does the PRP injection last?
Or what?
I mean, like after the injection, like you say, some of the steroid injection lasts for a few months, and then the pain will recur. How about the PRP? What's the?
When you are talking about pain medicine, all the pain medicine, not just PRP, not a steroid injection, even pain medication, okay? We cannot guarantee that how long you will be safe and you will be fine for the rest of your life, okay? We try for the steroid injection, they try to mask the symptoms. They don't cure it. They just mask the pain and inflammation. And after that, after a while, it will come back, okay? It would, after the steroid injection, 1 or 2 days later, you say, oh, I'm okay. My shoulder is much better, my knee is much better, my hip is much better. But for the PRP, it's not working like that. Okay, it's not something you do that after 2 days. So now I'm completely fine. No. After 2 days, maybe you say, so now this is still my pain, even sometimes get worse. But after 2 weeks, definitely it's worse. It's getting better. It's getting better and better. Okay? And depend on which joint we are doing PRP. For example, for shoulder, it works great. For knee, it works great. For hip, it works great. And depend on what you are doing after that. All the plan about what we are doing. We try to control your pain and send you to physio and make the muscle around strong. When the muscle gets strong, the pressure on the joint would reduce, okay? You cannot do just PRP and sit at home and say, oh, I still have pain. No, you still have to do this stuff. But the outcome would be much, much better. Much, much better.
Is it covered under Medicare?
Not all of the parts covered by Medicare. Some part is out of pocket, has some out of pocket fee. But to be honest, it is not my main concept. I'm not, as I said, I'm not here to selling this to you that it's this one is forced to do that. No. Okay, this is my last concept.
But I suppose for us.
Yeah, it is the main concept. Don't worry about that one. Don't worry about that one. Okay. I'm widely open for this one. I don't do this. I don't do medicine for money. And I just I just try to help. It doesn't matter.
Sorry, we will leave the Q&A at the end for you to complete the talk.
Okay. Okay. No, it is some part of our talk. Yeah, because having question is something important. So,
There are other overlaps to other people.
so, any of you has any problem for knee pain or joint pain or shoulder pain or headache? And what are you doing for them?
Exercise.
Yeah, it's most of the time it's because of, as I said, it is because of mutual care that we get. 60% of people, when they turn to 60, 50, they have mutual rupture in muscle here in supraspinal muscle. Any of us, if I go to the ultrasonography, they would find out some rupture there, and we always have pain when we do heavy lifting or something. For the PRP, we can repair them, okay, and we can buy some time for each of ourselves to, for example, instead of completely painful. If it is completely ruptured, we cannot do anything. We have to do surgery or decide that we want to do surgery or not. PRP is not working for complete rupture. It still is working for bursitis, but not complete rupture. But for micro rupture, it's working. Yes.
You mentioned about bursitis, which I had. Can you repeat what you said?
Okay. See, bursa, between the muscle and bone, we have something like pillow to just make a space for the muscle between the bone and muscle. Just some pillow, make it soft, and move it. Sometimes it gets inflamed. As I said, most of the doctors send people just for a steroid injection. I don't recommend it. With the PRP, it's exactly like oil that put on the pillow, make it softer, would stop the inflammation. It would help a lot. For bursitis, especially for shoulder, would help a lot. For shoulder and knee and hip, PRP is great. It's the first choice. And elbow. Not for neck. For neck, we can do something else. We can do nerve block or just in this way to control the pain and manage it, and a trigger point therapy. It is all the stuff that I can help you with this. But person by person is different, and about the condition that they have, it will be completely different. So, anything else?
What is nerve block you're talking about? Nerve block, what do you do?
Yes.
How about the finger clock?
Okay. Let's just answer this question after I come back to you. About the nerve block, when we have pain in our joints, okay, sometimes it's because of the inflammation in the joint, and our nerve would receive some impulse, something from the joint. Wow, we have something there. You feel pain to just, you can't, why you are taking Panadol, why you are taking anti-inflammatory to control the pain, okay? For the nerve block, it will reset. Because sometimes you need to do physio and you need to keep your joint active to get better. But because of the pain, you cannot. Okay, you are going to the physio, you are trying to do that, oh, I have pain, I cannot do that anymore. Okay, I don't want to push you to do some stuff that make injury, no. But instead of taking just tablets to control the pain that sometimes works, sometimes is not working, or chronic pain, you have pain in your shoulder for 3 months, 6 months, you have pain in your knee, especially in osteoarthritis. Osteoarthritis is inflammation of the joint on the knee. We do nerve block instead of give you anti-inflammatory or tablet or steroid injection every day. This nerve block can stay for 3 months to 6 months to just make it, you don't feel pain anymore there, like taking Panadol every day. Instead of taking Panadol, you can do nerve block.
So what is that? Is it an injection? Or?
It's injection. It's an injection under guide of ultrasonography. All the procedure that I do is under guide of ultrasonography because I prefer to find out where we are and what we want to do exactly. So what did you say?
Finger clock.
Yeah. It's a different story. For finger clog, we can do a steroid injection, depend. It is, as I said, it is not a key that I have that's open all the doors. Okay, I need to find out, I need to do ultrasonography first, let's see what's going on, and based on the condition, we can decide. Okay? Yes?
A lot of people suffer from this pain that starts from sciatica.
Yes.
So is that this your treatment?
Yes.
Does it apply to that?
Yes, yes. Lower back pain and pain shooting to your leg that usually said sciatica is a different thing that we are talking about today. We have a spine here and we have a hip bone here. The nerve, like a branch of trees, go there and pain shooting to back of your leg. So what we can do, and what happened, why we get this kind of pain? Sometimes because of the weakness of the muscle, but not always. Sometimes because the muscle there is like that, like this, my forefinger, and the nerve will pass through like this. Sometimes when we have a spasm in the muscle, the nerve would be stuck between the muscles and you feel pain. You will go to the physio that they try to release the pressure and you feel better. You are going to the chiro or physio or osteopath or massage. All of them, all the goal is reduce the pressure and release the muscle. Okay. I work as a sport medicine. Sometimes it's hard for people to go for physio. For example, they go 10-session physio or 10-session massage or chiro to just release them. Instead of all of that, under guide of ultrasonography, we would inject dextrose there. Dextrose is not a steroid, dextrose is water and sugar, because our muscle for releasing or for getting healthy or just repairing need energy, need calories, okay? With the water and sugar, the name is, medical name is dextrose, we just change the muscle gets relaxed. You would be fine. And the nerve would get released. It is something that we can do. Some of you, maybe you have diabetes. This dextrose injection is completely safe for diabetes. It do not increase your blood sugar because the amount of that we inject is very, very low. And it would not make any problem for diabetes, blood pressure, kidney. Very safe and recommended. And this is the things that I do. My main specialty in lower back pain. I'm working for lower back pain and sciatica for 3 years, and I start with lower back pain, to be honest. And we can help this for the sciatica, and instead of just going for physio for 10 sessions, 15 sessions, and after 15 sessions, I still have pain. I need to go and see neurosurgeon. I want to do MRI. But what is the point? If sometimes some of my patients come and say, sorry, I want to go for CT scan, or I want to go for MRI for lower back pain. So I always ask them, what would be the next step? What you want to do after that? You want to do surgery? So based on the guideline, 60% of people after surgery would not get any benefit for back pain. They still have pain because the nerve still would be blocked in the disc and the muscle gets weak very quick after surgery. And spinal surgery is something a little bit scary for all of us. This is for me. So instead of that, let's try to do something instead of do MRI or CT scan. Because always we need to think about next step. So this is the thing that I usually recommend. Sometimes you come to my clinic and say, Surena, I have numbness in my leg, I cannot move my leg anymore. And I cannot control my bladder, I cannot control my bowel. That would be a different story. You have to go for surgery, you don't have any other option. But sometimes you are here and say, Surena, I just have low back pain shooting to my leg, affect on my sleep, I cannot do my daily life, I cannot go out with my friend, because always I have pain. I usually go for golf or tennis, now I cannot go that. No, we can fix it. We can do this injection. Sometimes for lower back pain, it would take me 4 to 6 sessions, depending on the condition. But the benefit is good. The outcome would be fine. The patient would be fine with that. So, what else?
Hi, I had a question about my knee. I had a torn meniscus last year, and the radiologist actually, I had an MRI done, and the knee shows OA. I had osteoarthritis, and with the torn meniscus, so it's looking quite bad. So the radiologist recommended Uflexer injection, which is a course of 3 injections, which I did, and I find it helped. So I would like your thoughts about Uflexer injection, and it's fully not built. Actually, a lot of senior people, they're not aware of this injection. And so far, I find it kind of working. And plus hydrotherapy, I go twice a week. I find that it's building the muscle, and plus the Uflexer injection is kind of like helping my knee. So I was thinking, what are your thoughts about Uflexer injection for the knee and compared to PRP? Thank you.
Uflexer injection is here. The other name
like a
is
cushion, yeah, like a lubricant.
Yes.
Yeah.
Yes. The other name of the Uflexer is hyaluronic injection. We just inject hyaluronic acid. It's like exactly like oil to put. Yes. Yeah. And go to the joint and make joint more flexible. Okay. Uflexer is still very good, and it's recommended based on the guideline. But Uflexer is just like oil. It would not help for repairing. Okay, but PRP would help for repairing. Okay? More or less they are working the same, but as I said, Uflexer is just for making oily and make a space in the joint. PRP do the same, but would help for repairing, to repair the cartilage there. And it's good for mild to moderate knee osteoarthritis. It's recommended. Yeah? No worries. So anything else?
Dr. Surena?
Yes.
What's the difference between steroid jabs, steroid and this BR? Is it BRP?
Yes.
Yeah?
Yes. As I said, a steroid injection 20 years ago when doctors find a steroid, the other name was magical solution for everything. You have flu, take prednisolone, you will be fine. You have gout, take prednisolone, you will be fine. You have any other pain, take prednisolone, you will be fine. And yeah, you will be fine, definitely you will be fine. But how? It just masks the symptoms. Still you have problem, but you cannot feel it, okay? And after a while, so you didn't resolve the solution, and the problem would resolve you after a while. The problem would come back, you would get pain. The joint would get pain again because the steroid would help for 1 month, 2 months, 3 months, and after that it would come back. Or the stronger, you can do a steroid injection, yes, again you can do. but the pain would come back all the stronger. After a while, you cannot do any steroid injection because the steroid has some side effect, would make the bone weaker, would affect on the blood pressure, would affect on the blood sugar. But the PRP doesn't have any of these symptoms. PRP is we take it from your blood. We just separate the rich plasma part from your blood, and we will inject to the place that we have, and it would reduce and subside the inflammation. This is the PRP. How is PRP work? So, did I answer your question? Yeah. Okay. So, it is all the things that I want to talk about with you today. I don't want to waste your time a lot. I hate to talk a lot, and people get sleepy, tired. You have a lot of things to do. The weather is fantastic today. You need to go out and enjoy a lot today. Be healthy, keep moving, try to be active. As a kid, we love our grandparents, and we need you. We need to be alive, laughing, happy. Sometimes kids cannot talk some things with our parents, but they cannot always talk. I'm around 40 years old, and to be honest, I enjoy a lot with my grandmother, and I always have a lot of fun. I always can spend a lot of fun with her. She cannot walk anymore, but we still have a lot of fun. Please be healthy and try to see your GP, do whatever that they want, they ask you to do. You are all what to say, about all the positive energy that we have in our family. You are main things in our family, and you keep your family beside each other. So thank you so much for your time today. I enjoy a lot, and I hope it's going to be thank you for you.
Can you leave your card behind, please?
Yes, to be honest, I'm supposed to bring all my stuff today, but then I went for my stuff, I finished it because I spent time. I will leave it today here, maybe afternoon or tomorrow, and you can catch it from. Thank you so
I have
much.
a question about footballers. Do they use PRP or do they use steroids?
For what?
Or, you know, the footballers to get over their injury quickly when they have
I work as a sport medicine doctor for the football player, or depend on the condition. But for the torn, yes, we are using therapy, but we are using the other stuff for them.
Do you use steroids as well?
No, no, I'm not a fan of this. I don't think I'm Yes?
Thank you.
Thank you so much. Thank you all for your time.